Welcome back to CTV Morning Live. We are in our Ask the Expert segment with Dr. Lalonde from the Chrysalis Rejuvenation Clinic. You can give us a call live on the air, 789-6559, extension 2803. You can always send us in a question via email, ottawa.morning@ctv.ca. And we do have our new Facebook page, CTV Ottawa Morning Live. And immediately, Dr. Lalonde, we're going to get to a caller. Joan, I believe, from Ottawa is on the line. Good morning, Joan.
Good morning. I'd like to ask the doctor, even though I'm over 60, actually I'm closer to 68, if I still could have thermage done on my face, and how many sessions and how much would it cost?
Yes, well, age is not a strict criteria, put it that way. It really depends on the quality of your skin. So that's why the consultation is so important. So when we have a look at you, you see, you may have some friends that are in their 70s or 80s. When you pull on their skin, all of a sudden it sort of practically stays out there, and then that skin that's probably gone too far. But I've certainly have seen people in their, at 70, where they still have the skin of somebody who looks much, much younger and feels younger. So it's really the feel of the skin, how much collagen is still there. That seems to be a much more important criteria than the strict age. So at 68, I have done people in that age group with some results. I can tell you that the results probably are not as predictable. So we really have to look at you, we have to feel your skin and make a decision based on that. So I tell people, with thermage at age 50 that they probably have a 80–90% chance of having a significant result. And when they get to 65, let's say, it may be more of a 50-50. So it depends on, as I say, on the quality of your skin and the risks that you want to take as far as possibilities of good results.
Because we had mentioned prior to going to the commercial that you said you prefer to work with people between the ages of 35 and 60 when you're dealing with thermage. So it really, to answer Joan's question, even 68, it's really going to depend on the quality of the skin where they're at.
Exactly. It's not strictly age. So it's definitely worth a consult, Joan.
Hopefully, Joan, we were able to answer your question. Now, speaking of these consults, we mentioned fillers and we mentioned Botox, then we mentioned thermage. It sometimes can be overwhelming that people don't really realize what procedure is going to be the best for what it is that they're looking to do. That usually happens within the consultation.
Exactly, and it's very important. I mean, it's something that, the people always ask me, or they ask me, well, what do you think I should have done? And I say, well, that's not the issue. The issue is like, what do you see in the mirror and what would you like to have changed? And then we'll give you options. So we go through the options. So it may be a little bit of Botox, particularly if they're looking for something more of an immediate gratification. Botox kicks in within 3 or 4 days. So if you have lines around the eyes or in the forehead area, the frown lines, those are things that can be addressed very easily and very predictably with Botox. On the other hand, if it's something of a bit of volume loss or other lines lower down in the face, in the mid-face, generally fillers work very well. And again, you have this immediate result. But you may want to combine both. You may want to go into a resurfacing laser. You may want to go into thermage, like we've talked about. So we can lay out a plan of action. Everything doesn't have to be done at once. So you may decide that, depending on your budget, that you want to plan these things out over the next year. And these are the things I want to have done.
Some of these things are just a one-shot deal. Like as Joan was mentioning, how many times would you want on the face? Thermage is usually a one-shot and you're done.
That's
whereas
right.
Others might be more of a repetitive, heading in
exactly.
to the office.
If you, for instance, if you have issues about lax skin and you think you want thermage, but additionally you may have brown spots on your face, well, it may be that a resurfacing laser that also tightens up the skin but also addresses brown spots may be the best option for you. So as I say, there's never just one option. There's many. And of course, I mean, we're a non-surgical clinic, but there's always the option of surgery, of course, and if I think that we can't help you enough, then I'm going to refer you on to a plastic surgeon.
Is there, and there's also too the budget aspect, right? Because the possibilities are endless depending on what you're able to offer and what they can afford.
Absolutely. Every procedure we have, from the entry-level procedures for things like microdermabrasion, chemical peels, which can achieve a lot. If you're looking at fine lines, sometimes around the mouth or the eyes, sometimes a series of peels works very well, and that's very affordable. But if you want, a more drastic result, as it were, or a more impressive result, then you may have to go to a resurfacing laser or to thermage, and those are more expensive. Okay, but as I say, I think we can lay out a plan that's amenable to anyone's budget.
We have another question that I want to get to, and we have coming, one of them coming via email this morning, so we'll take a look at the screen, and this one is coming from Janet. I'm considering getting a Fraxel Laser treatment to treat my acne scars. Is it good for darker skin? Will it have the same effect?
Well, I mean, that's an excellent question. This sounds like somebody who's pretty informed, because a Fraxel is a resurfacing laser, and I think we talked about it a few weeks ago when we were on the air. But it is the optimum technology for dark-skinned people for acne scars. We do have two main technologies for that in our clinic. One is the CO2 laser, but that is only done on skin types 1, 2, and 3. When you have darker skin, you're into the 4, 5, or 6 categories, or 6 skin types. And those, the Fraxel is the accepted best technology on the market today. As a matter of fact, there are a number of seminars now given just for Skin of Color series, and they highlight the fact that Fraxel is the best technology for acne scars and dark-skinned people.
So hopefully, Janet, you've got your answer right there.
That's
you
right.
Just needed that final push as to knowing whether or not it was the good route to go. All right, we're going to take a short commercial break. We're going to be back for another segment of Ask the Experts with Dr. Lalonde right after this. The information on how to get a hold of us is going to pop up on your screen. We're back after this commercial break.
I should have kissed you.